First and foremost, I would like to take this opportunity to thank the organizer for having me this evening. And I was asked to talk about regenerative medicine. Although this is not my forte, but I try my best to summarize to make it simple for everybody to understand. Now, I've been asked to talk about stem cell and also tissue re-engineering. So this is the regenerative medicine and as well as biotech, restoring health naturally. And before we do, perhaps what are the potential of regenerative medicine in time to come? Regenerative medicine is a groundbreaking field focusing mainly on repairing, replacing the damaged cells, tissue or organ. This is a simple definition of regenerative medicine. By restoring normal function and often utilizing techniques like stem cells and tissue engineering. This is the basic principle of regenerative medicine. By stimulating the body's own repair mechanism to functionally heal previously irreparable tissue or organs. And recently I just read an article, and this is a very interesting. The Japanese scientists have started testing a new drug in human that could regrow the real teeth and offering a natural alternative to implant and dentures. So the drug called TRG35 blocks a protein known as the USAG1, which normally stops teeth from growing and developing. So this is exciting technology because regenerative medicine is evolving very, very fast, and this is a very interesting field to explore and to learn. Now, regenerative medicine includes growing tissue and organ in the lab and implanting them to the body that cannot heal itself. For example, you can take the tissue in your own body and then can culture and grow it before implanting it back, and this will have less tissue rejection. If the tissue is from someone else, then the rejection is much higher. So these are the issues that we can actually use the technology for growing the tissue or organ in our body. And obviously, stem cell or progenitor cells obtained via directed differentiation, which means using cell therapies. We can use stem cells as another form of regenerative medicine. Include the regeneration by biological active molecules given alone or as a secretion by infusing cells and transplantation of in vitro grown. In vitro means outside, growing the cells and organ and tissue and to implant into the same person. So these are some of the definition of regenerative medicine. Let's look back at history. Always look back at history. In 19th century, regenerative medicine is one of them is skin grafting, and advances in the organ transplant to restore structure and function back again. And obviously, when you want to transfer organ transplant, the best is identical twin, whereby the rejection rate will be very low. And tissue engineering regenerate and grow the new cells. This is a technology that we have. We can regenerate and grow the new cells before implanting back into the person. And cellular therapy eventually leads to stem cell research. And the first cell therapies were intended to slow the aging process. Now, way back in 1930, Paul Nilhan injected cells of young animals into the patient in the hope that it can slow down the aging process. And in 1956, to treat leukemia by inserting bone marrow from healthy person to patient, especially those identical twin, have been accepted as one of the form of treatment. In 1992, a new branch of medicine, that is a regenerative medicine, attempts to change the course of chronic diseases, regenerate failing organ. That means if you have a failing organ, so regenerative medicine may help chronic diseases. And in 1999, restore to normal function, that is the regenerative medicine is used to restore to normal function that which is damaged by disease, trauma, or over a period of time, wear and tear. And in 1995 to 1998, the human embryonic stem cells and human embryonic germ cells was discovered. And in year 2000, stem cell therapies and multiple research has been done from cord blood and hematopoietic stem cells, only blood cells, and obviously we are looking at induced pluripotent stem cell, which means it can differentiate to any other type of cell. Meaning if the cells in the body, they can grow, and as well as you can use the stem cell to differentiate to different type of cells in the body, and cells becomes tissue, tissue become organs. That is the principle. So now you look into the life expectancy by sex in Malaysia. Over the years since 1950 until today, the life expectancy from 50 years has increased, almost reaching to 79.4 for female and male 74.3. That shows that health has improved tremendously in this country, and the reason being of our life expectancy have increased is based on a few factors. Number one, better healthcare, access to hospital, clinics, and trained medical professionals have improved significantly as compared to 1950s, 1960s. And more important is that the vaccination program that is being introduced by the government. And vaccination is the second most important public health measures in the world to address health issues. And the first most important actually is clean water. And clean water is one of the public health intervention that has actually benefited many people around the world. So improve the living condition when we have clean water, better sanitation, safe housing have reduced the spread of infectious diseases. However, I think more importantly is economic development. A growing economy has provided better jobs, better income, and access to healthcare and nutritional food. And these are one of the reasons why our lifespan has increased. And more important is the government initiative in public health campaign, maternal child health program, as well as healthcare that is being provided to improve survival and longevity. But more important is that today, although the lifespan have increased, but when you have 60 years and above, 50% of the population in Malaysia have two comorbidities, meaning comorbidities like diabetes, hypertension, at least two, hypercholesterol, and etc. So these are the challenges that we have. How can we live longer and healthier? And when you are 70s, 50% of population have three, not two, but three. Maybe hypertension, diabetes, heart diseases, and etc. So these are the challenges that we need to look at. How can we live longer but also healthier? And thereby you can reduce the cost of treatment and focus more on preventive measures. So when we look into this data of life expectancy, you can see compared to Japan, Singapore, Europe, America, Malaysia, Asia and the world. This data is from the One World data. Is actually you can find it internet, and it shows that our lifespan has increased almost to above 70 years as compared to other countries as well. However, looking into the disease burden of non-communicable diseases, now Malaysia is facing challenges from communicable diseases like malaria, TB, and then obviously during the crisis, COVID-19. But now we are also faced with non-communicable diseases, diabetes, hypertension, etc., cancer, and etc. So these are some of the challenges that we face, and also we are facing an aging population. More important is how can we make sure we live longer and also we live healthier. And if you were to look back our non-communicable diseases, now that COVID-19 is there, infection is still there, but we all have the antibody now to fight with COVID-19. So we can get the infection, but the fatality from COVID-19 is less now. But our challenge is the non-communicable diseases. If you look into the diabetes, 1 in 6 Malaysian aged 18 years and above have diabetes. 1 in 3 Malaysian 18 years and above have hypertension. High cholesterol, 3 out of 10 Malaysian have high cholesterol. And obviously, inadequate dietary intake. 9 out of 10 Malaysian consume inadequate amount of daily recommended fruits and vegetables. And obviously, physically non-active. 1 in 3 Malaysian physically non-active. And overweight, obesity. You can see 1 in 2 Malaysian have issues of overweight. So these are all challenging, and not getting 7 hours of sleep. 2 out of Malaysians have issues of sleeping. And these are all the issues that can hamper our health and also the non-communicable diseases. So, and I just take this one example of lifespan and health span. Musculoskeletal diseases like the knee, osteoarthritis are the second leading cause of disability based on how many years people live with the condition affecting them. For example, first 1 or 2 years, you will have mild pain and stiffness of the knee joint. Then eventually become moderate for 3 to 5 years, and later become chronic pain, difficulty in standing, walking, and etc. So your mobility will be affected. And these are the challenges. Although you can be diagnosed at the early age of 45 to 50, but because of the prolonged lifespan, you can suffer the symptoms until more than 70. So these are the challenging debilitating or mobility that we face over the period of time. And if you look, the chronic inflammation like osteoarthritis of the knee affect individual aged 55 and above. 1 out of 4 will have osteoarthritis. And individual aged 65 and above, 2 out of 5 will have some form of osteoarthritis. I'm just using osteoarthritis of the knee as an example. So once you have osteoarthritis, then walking will be an issue, carrying object will be issue, and that hamper the mobility of a person. So growing interest in regenerative medicine, such as mesenchymal stromal cell derived medicinal product, which aims to not only relieve the symptom but potentially modify the disease progression. So with the mesenchymal stromal cells, you can see that it helps to reduce the inflammation, for example in the knee, and promote the cartilage for remodeling. And this will help in terms of improve the symptoms over a period of time. So we produce with treatment from mesenchymal stromal cell, it may help the knee to improve the inflammation as well as the progression. Now let's look into the basic of science of the cell cycle. Now when we look into a cell, number one is that most important, the cell, they have a nucleus. Inside the cell, this is a cell, inside the cell is a nucleus, whereby the DNA is inside the nucleus. And obviously the cytoplasma is outside the nucleus, and in the cell, and we have these are the structure of the membrane of the cell. One cell. This is how the cells contain. Every cell have a nucleus, and the nucleus contain the DNA, which means is the genetic information. Now, more important, you look into here is that the DNA is inside the nucleus of the cell, and the cell is the smallest unit of life in the body. And when you have millions of cells comes together, or billions of cells comes together, it forms the tissue comprised of many cells to form a functional unit. And from many tissues, billions of tissues form an organ comprised of many tissues to form a functional unit and eventually becomes an organism. So this is the structure, levels of organization in our body. So when we talk about cells, this is the issue that we talk about, the DNA, cell healing, and etc. And the very smallest unit of life in our body. Every day without fail, we lose about 50 to 70 billion cells from your skin, from elsewhere, and replaced by 50 to 70 billion cells. More importantly, there is a balance between losing and also replacing, and a new cell and old cell form in a balance. And if there's a loss of balance, more cells be produced and replacing the existing loss. If more cells being produced, then you get tumor. Tumor means the growth of cells, uncontrolled growth of cells. But if the cell continue to grow and can spread elsewhere and invade the tissue, then we call this becomes a cancer cell. So more important is that we need to look into the cell formation and cell loss in the balance. And that is important to make sure that we are healthy. What are stem cells? This is the most important subject. And we have our expert to talk in detail about stem cell. But stem cells are the foundation from which every organ and tissue in our body grow from stem cell. Stem cells are the foundation from every organ. So stem cells are defined by two properties. One, they can self-renew. That means make copies of themselves. That is one function of the stem cell. And second, differentiate, develop into more specialized cells. So the cells can continue to grow. This is self-renewed. That is, for example, I will give a few examples in a while's time. Or differentiate. These are the most important two functions of the stem cell. So what do stem cells do? And we need to think, remember the last time we got our hair cut and then eventually the cells will repair and continue to grow. This is one example. When we have an injury, a tissue healing process, the first thing is that you got bleeding. When you have bleeding, there's a blood clot formation. This is what we call stage 1 hemostasis. That means the blood clot formed and then that's clot formation. And the stage 2 is the inflammation, whereby you have swelling, redness, and warm and etc. Whereby accumulation of the neutrophil, macrophages, and all the inflammatory cells being released. And more important, if you move towards the stage 3 after 3 days to 3 weeks, is the proliferation of the fibroblasts, whereby angiogenesis, proliferation of fibroblasts and epithelialization occur. Then the formation of the scar and you go through a remodeling process. These are the normal healing process that we have. The question is, how can we harness these healing properties, healing process in our body to make it more efficient in our body? So in terms of proliferation phase, for example, how the cells been transformed into new skin or created blood cell, for example. Again, as I mentioned earlier, the cell is self-renew and differentiate. These are the two components of stem cell. So you can look into all our body, for example, growing of the new hair, regrowing of the cartilages of the bone in osteoarthritis, damage to the intestinal lining repaired frequently, and as well as heart muscle regrow after a heart attack. So these are some of the response, just like the wound healing, are in our body. Now the next thing is that how can we enhance these stem cells in our body? Now before that, let's look at the types of stem cells. So there are many different sources of stem cell. The main categories are from our own stem cell. We call it autologous, meaning it's our own cells. We can take it out, regrow it, and then implant it back to our body. And that is something that can be done. And versus the stem cells belonging to others, using other people's stem cell, but there is a foreign cell and may have a rejection unless it's a identical twin. And common sources include amniotic fluid, placenta, umbilical cord that we can use from foreign stem cell. And these are the induced pluripotent stem cell, embryonic stem cell, and mesenchymal stem cell. These are the three groups, and they can differentiate to different tissue in our body, which is part of healing. That means if you have heart attack, then the healing is in the heart, healing in our body, other parts, and etc. So, if you look into this, is basically the mesenchymal stromal stem cell, and whereby it is involved in repair and modulation. And these are the adult stem cells found in various tissue, especially the bone marrow, umbilical cord, and they can develop into a limited range of cell type, including bone, cartilages, and fat. So this happens, and we need to have the technology to enhance the development of stem cells in our body to assist our body, especially towards the elderly now, because when you reach elderly, you have a lot of wear and tear, and this may help if we use the technology of stem cell. Now the next question is, are stem cells treatment approved by National Pharmaceutical Regulatory Authority in the Ministry of Health? Do we have the approval given by the Ministry of Health? So if we to look into NPRA has not given any approval for marketing. There's no cellular derived medicinal product has been approved by NPRA. There is no stem cell stromal cell, mesenchymal stromal cell products fully registered as a new drug in Malaysia. So meaning it's not been given the full approval yet, but they have given the cell therapy can be used under clinical trials protocol approved by NPRA under clinical trial investigatory license and the medical research and ethics committee, meaning Ministry of Health allow clinical trials to study more about this stem cell in terms of how we grow it, how we use it, how we control the stem cell, whereby how we able to use this stem cell for the betterment of our patient. So a lot of clinical trials has been done, but none of the cell therapy as well as mesenchymal stromal cells has been approved yet. But There's osteoarthritis, for example. There are already study been done, data being collected, scientific fact already available, and in the process of registration to be approved by NPRA. So the process, so that we make sure that whatever we use and approve will be safe for our patient. This is the key. Safe in terms of you can grow it, you can help to heal, but more important to replace the damaged cell, but also not to overgrow the cells, for example. So how much does this cost? This is where at the moment, because of the research and there's a new technology, you look into the cost is very, very high. Not many people can afford. And we are also in clinical trials doing this kind of study, and it's also we need funding. Funding comes from the grant from the ministry, mostly and etc. But still, we need more data, more science, and more facts before this can be approved. And are there any stem cells approved by NPRA at the moment? This is one approval in 2024 in February, whereby the Ministry of Health under NPRA have approved gene therapy, cell and gene therapy product. We call it Zolgensma, and this is the most expensive medicine or approval medicine in NPRA in our country. The treatment is almost 8 million ringgit. 8 million for treatment, normally given to spinal muscular dystrophy, age less than 2 years old, but the cost is exorbitant, almost 8 million ringgit. And this is the most expensive drug ever been registered in our country. So I think this is a platform, a groundbreaking platform for us to focus, and technology is evolving, and we hope that we can actually continue to come up with treatment and able to get this medicine registered. So in conclusion, I think this is my last slide. In regenerative medicine, tissue engineering to regenerate and grow the new cells in cellular therapy leading to stem cell research is still ongoing. But more important is we need to strike a balance between the innovation and the technology and the regulation and safety. So Ministry of Health make sure that whatever you accept is safe for the body and make sure that it doesn't cause harm. In the Ministry of Health, first do no harm. And obviously, we also want to encourage in terms of innovation, and innovation will make a big difference. This is why we need to strike a balance between innovation and as well as regulation and safety. Okay, with that, ladies and gentlemen, thank you for your attention. Thank you.